flexible back fibers and the masseter. So this itself creates a lot of pressure. So we'll be able to see that on the CBCT. So we call this gonial angle. When the corner of the mandible are more developed, they could be developed bilaterally or unilaterally, one more than the other. So that right off the back tells me the right masseter is working much harder than the left side. Okay? You've seen all these. Patient come to the office, your hygienist will take this, let me go ahead and clean this up for you, and we'll give them back again. Or we may say, well, let's go a new night guard for you because this is all worn down. Concrete. They're gonna break their teeth or they're gonna break the night guard. So we're fighting an uphill battle because we have to deal with the muscles of mastication. So again, the normal anatomy of the disc, normal position anteriorly, and when you look at the CBCT, again, you appreciate or understand the lack of disc space, superiorize the joint, and how the disc is being, the condyle is being basically, again, temporalis muscle having the three branch of fibers, as Dr. Lim has showed you earlier. So a lot of times this can trigger dental problems, meaning that if a patient like that slide that you saw, he showed that patient had an endo done and apical done. So a lot of times just palpate these muscles. Our patient that we see, we can get any help from our dentist colleagues. So their conclusion is that correlation between apnea-hypopnea index and severity of tooth wear in patient diagnosed with bruxism. So they noticed that, yes, the more you have clinching and grinding, the higher your AHI is. Isn't that interesting? So if we were in a, yes or no, do you wake up at night to go to the bathroom? Because they don't wake up to go to a party, they wake up to go to the bathroom. Yes or no? Do you wake up in the morning fresh? Yes or no? And do you get tired around 3 or 4 o'clock in the afternoon? Yes or no? Why 3 o'clock, 4 o'clock? Because that's the circadian clock that kicks in. So it makes your body tired. But if they're answering yes to any one of these questions, they have sleep problems. They just don't know it. So it's not normal to snore. Snoring is a sign that there is a sleep problem. It's not normal to get up and go to the bathroom. Ask any physicians. Oh, I just get up 3 times to go to the bathroom. 3 times a night? How long does it take you to sleep? Well, 40 minutes when you have insomnia. And are you fresh in the morning? Not usually. I have to have 2 coffees. So all of these problems, just put this in your medical questionnaires. You'll be able to diagnose a lot of sleep problems in your practices. All right. So conclusion, tooth wear could be a tool to identify those patients with risk of having OSAs. The highlight the importance of this is let's make sure that the dentist knows how to refer, or let's communicate with each other. So again, we're not going to go into a whole lot of the design and topics and all that stuff, but these are one of the appliances that I use. These are mandibular advanced devices. These are FDA approved. The beauty about them is that I can have these with the tongue lifters. I can have them anterior contact. I can have them posterior contact depending on the type of patient. If I have a patient that has pain and sleep, I will put them in anterior contact up there. So again, I hope that we have a different mentality of looking at night guards or splint or whatever we want to call them. So how are we going to be able to help the patient? You have to understand that you need to control the muscle mastication. So night guard make OSA worse, yes. Patient that you have no idea if they are choking at night or they're not sleeping well at night, and you stick something in their mouth, be it a night guard, then you're making the apneic problem worse. You're graduating from moderate to severe. So this is a study that talks about that. Risk with dental occlusal spleen. 4 out of 10 apneic patient gets worse, light to mild, mild to severe. 50% increase in AHI. Okay? So we try to increase the video, not paying attention to what has happened to the condyle itself. So if you look at this diagram, everything, all the bad things happens on the red columns, all the way, the line from G to I. So formation of the lip in anterior area is what we see. Then we start having the breakage of the osteophyte, and then we start having a subcrestal cyst formation. Beginning of osteoarthritis. You saw these earlier, so anterior disc displacement with reduction, and then we start losing the coronal surface of the condyle, then we begin to have a big. Let's look at this patient. I would say this is a normal anatomy of the left condyle, but look at the right condyle. It's all torn apart. We call that bird pig effect. It looks like a bird pig. So yes, even though it's on the same patient, it's a good